wow, for these 18-year-olds, their lives ended effectively when they were almost 16. I mean, they've had to sit in their house and lose the entire experience of like being a teenager. I have no idea what that does to people.
Yeah.
I literally have no idea. I'm gonna bet that it's probably not good.
Yeah, it's probably not good. So let's dig into that today because I think it's an interesting and vitally important topic. First off, my name is James Lee. Welcome to my channel 5149, where I talk business, politics, and society. And today we are going to examine what effects the pandemic has had on adolescent and teen development.
Many children and teenagers are feeling isolated this year, especially now that the holidays are upon us. Remote learning and social distancing have drastically reduced the quality of life for millions of kids across the U.S. because of the pandemic. The CDC has reported mental health-related emergency department visits were up 24% for 5 to 11-year-olds and 31% for 12 to 17-year-olds from April through October compared to last year.
I have no doubt in my mind that the pandemic has wreaked havoc on the mental health of young people in this country. I mean, it's something that's deeply affected me over the last year and a half, so I can only imagine what it's like for them being told that you have to isolate, you can't see friends, you can't go to school, you can't play sports, etc., and having absolutely no control over the situation.
What losses have teenagers in particular experienced during the pandemic compared to younger children?
Teenagers have really lost out when it comes to peer relationships. In adolescence, peer relationships actually matter more almost than family relationships. That's where they get their reality checks. That's where they share their problems. So they've lost that. They've lost a lot of the benchmarks that are so significant in high school, graduations and proms, even how the things that they don't like taking standardized tests, going into a classroom, sharing ideas. They may complain about going to school. Teenagers actually don't mind as much as we think. We don't give them enough credit. They're missing out on dating, meeting new people, flirting. Those things are they're a natural part of adolescence. This is a generation that's going to have lost a year to a year and a half of this.
Right, I didn't think much of this until I started researching this story, but if you're in middle school, high school, or even college, you've basically lost 10 to 15% of your life so far to this pandemic. And that can be really traumatizing. I mean, as uncomfortable as I was throughout middle school and high school, I was in the band, so lugging around a trombone on the school bus, definitely some tough times. But compared to losing a couple years of my life to Zoom classes and isolating at home, I definitely choose the former. June data from the Centers for Disease Control and Prevention shows that 63% of young people reported experiencing substantial symptoms of anxiety and depression. 63% of young people experiencing substantial symptoms of anxiety and depression. If we're talking about following the science or following the research to dictate what our public health priorities should be, this finding should be way up there. It should be very alarming for all of us.
I think we often undersell adolescents in terms of how much empathy they have for their families. It seems like they're not empathic. I've got a teenager, I get it, but they are. And a lot of them are acutely aware of the hardships their parents are going through in terms of money, in terms of lost jobs, in terms of fears about health. And they're really struggling with that. And they often don't know where to take that powerlessness because they can't make it go away. And that can come out in so many ways. So I think teenagers in some ways are shouldering the burdens of both children and adults during this pandemic.
Wow, consider that. The young people in this country, very much, in my opinion, innocent bystanders to all of this, minimal control over the situation, having to shoulder the burden of, what their parents are facing, the virus, maybe being really careful about not wanting to bring COVID back into the home where there might be some family members who are more vulnerable to the disease, but also navigating and dealing with the hardships that come with growing up, fitting in, academics, etc. This reminds me a little bit of Harry Potter. Where are the adults? I mean, there were some adults present fighting Voldemort, the most powerful dark wizard to ever live, but not as many as I would have liked to have seen. You know what I mean? The adult to kid ratio was way off. But really, in all seriousness, for a better part of a year, young people have been cut off from normal day-to-day activities, class, lunch, sports, hanging out. There's no release valve for them, which I imagine gets very difficult.
Lisa Horowitz is a clinical psychologist at the National Institute of Mental Health and has studied suicide for decades.
forced isolation and kids not being in school and being cut off from their social contacts, that really makes it even harder to when you're struggling with any kind of mental health issues.
Prior to the pandemic, suicide was the second leading cause of death among people ages 10 to 24. For that same age group, the suicide rate increased by more than 50% between 2007 and 2017. Since the pandemic began, local officials around the country have reported more youth suicides.
The increase in suicide rates is absolutely horrifying to see, and it's something observable on a macro level. Things are measurably getting worse and worse from year to year. You could see the changes from one year to the next, and it's something that we have to take seriously because it's perhaps a harbinger of future disruptions. According to a study released by the CDC, more than a quarter of people surveyed between the ages of 18 and 24 have seriously considered suicide in the past 30 days, and 3/4 have experienced more than one adverse mental or behavioral health symptoms. Once again, these numbers are astounding and incredibly alarming for the future well-being of our society. Just to give a few examples here, a 2018 Lancet Commission report on mental health has stated that mental disorders are on the rise in every country in the world and will cost the global economy an estimated $16 trillion by 2030. Psychological disorders can also exacerbate other public health issues, increasing the burden on national economies and impeding international public health efforts. Violence and incarceration among mentally ill individuals can place a significant financial and social burden on communities and nations. So yeah, we can't just say, hey, schools are open again, all is well, let's move on. The reason why we can't do that is because we have to actively address and deal with the effects that the pandemic has had on young people for the last year and a half, because some of these effects can linger for a long time. For example, even as in-person classes have resumed, we're seeing a huge surge in absenteeism. In California, Oakland Unified reported that almost 33% of students were chronically absent as of mid-September. Among transitional kindergartners to fifth graders, the rate was higher than 37%. 2 years ago, only 14% in that age group were chronically absent. Students in quarantine make up the bulk of absences, but not all. Some students are skipping school because of lingering mental health or behavioral challenges, while others are afraid of contracting COVID. Some have gotten out of the habit of daily school attendance or simply don't want to be there. And I think this issue is something that is woefully under-discussed and neglected. I mean, I can imagine that a bunch of school absences is probably not good in the long run, with kids falling further behind academically and not getting the social stimulus that they need to develop as they transition from adolescence to adulthood. And a thought I'd like to end on today is, might this be a product of something fundamentally rotten in our modern American society? I mean, I totally get that public health and safety are unquestionably paramount, but something I've noticed throughout this pandemic is that public policies are often not driven by science or research, but by business and politics. And what I mean by that is that business interests drive most, if not all, public policy. This is an article from the end of last year. Why are U.S. schools closing but not bars? New York City, home to the nation's largest school system, announced Wednesday that it's halting in-person classes at all public schools starting Thursday, November 19th, as the city's COVID-19 positivity rate hit 3%. Mayor Bill de Blasio had previously set 3% as the benchmark for closing schools, but many residents are outraged because the mayor is not closing gyms or indoor dining at bars and restaurants, which are operating at reduced capacity, but are still considered higher risk areas as vectors of the disease. What's good for business is not always good for society, and in many cases, it's counter to what's good for society. I'm not saying business is all bad, but there needs to be countervailing forces to balance each other out, and right now, the scales tip very much in the favor of business. On another note, David Sirota, he recently likened our media coverage of important societal issues to the way ESPN covers a basketball game. Basically, everything is viewed and discussed through the lens of teams. Us versus them, right versus left. It's this type of mentality and framing, in my opinion, that leads to policies that seek only to own the other side. Something like DeSantis in Florida threatening to fine state, counties, and cities over vaccine mandates, or Democratic representatives putting on masks only during the photo ops, but not at other times. I mean, come on. In my opinion, it's these types of performative point-scoring jabs that seek to one-up the other side that has prolonged and even exacerbated the deadliness of the pandemic here in America. And kids, adolescents, young adults are caught in the middle of all of this. Obviously, there is no easy answer to all of this, and the solutions can only come if we together can focus on prioritizing the building of a healthy society instead of a society of winners and losers. And that's something really lacking in today's mainstream political and media landscape. That is it for this week. Thank you so much for watching. I hope that was informative. I'd love to hear what you think about all of this and how you've personally dealt with the pandemic. So please feel free to share your thoughts in the comments section below. If you've enjoyed this video, you can help me out a lot by clicking on that like button and also sharing this video wherever you engage with others on the interwebs. Also, please consider subscribing if you haven't yet done so I can keep making more videos. And as always, thank you so much for your time, and I will see you next week.